Hi, welcome to another edition of Hashtag Finance. I'm your host, Barrington Miller, and today I have a very special guest, Oren Shuster from IMC. He is the CEO, and he has come from a long ways away. Welcome to the show.
Thank you very much.
Where are you from?
Originally, I'm from Israel, but mostly I live in airplanes,
When we were just talking off the air, I was saying I sat beside a trader, because I used to trade, and he's from Israel. And so he would always tell me about it. I haven't had the privilege of going yet, but he would tell me about it, and he always comes back super tanned, 10 pounds overweight, and he was describing the beaches and the weather and just the culture. And, I watch Anthony Bourdain and Parts Unknown and when he travels. And, of course, I love food. But, yeah, tell us a little bit about Israel.
So Israel is beautiful. You're completely right. Beautiful beaches, excellent food. Israeli chefs are very creative, like in other stuff. And so... And it's very convenient to travel in Israel because if you're in Tel Aviv, within a few hours you cover the whole country.
Oh, really?
So, yeah, it's very small. And, you can take a car 1 hour to Jerusalem, 1 hour and a half Sea of Galilee, very convenient.
Israel has a very, very well-known history of research and development in the cannabis space. Your company or you have had a license since 2010. Mm-hmm. How did you become one of the first license holder for cannabis?
So you're right. First of all, Israel is pioneering in cannabis research. The THC, for example, was discovered by Professor Meshulam in the early 60s, and since then there is research about cannabis in Israel. We've been one of the first companies that got a license from the Ministry of Health. They have done like a small plan to learn a bit more about how medical cannabis can help patients. In the beginning, we volunteered to supply cannabis without getting payment from patients, and only later it became commercial.
Wow. So I know there's between 45,000 and 50,000 medical patients currently right now in Israel. And what does IMC do? Like, what's your operation? What's your business?
So we started in Israel to grow pharma-grade medical cannabis in 2010, and we've done it as vertical integration. We've done the grow, the processing, and we supply directly to patients. Because we've been one of the first, so we had to develop our own machinery and our own methods. Today in our facility, all the post-harvest, for example, is completely automated. We developed machinery for that. We have IP.
Do you own the IP on that?
Yeah.
Oh.
Of course. We have IP. We invested a lot of money along the years. But we saved about 80% of the labor because of that.
Oh, wow.
And we can do very large quantities in a very short time, which give us a huge competitive advantage. And now our main market is the EU market. We're still working in Israel. In Israel, everything has to be GMP certified, which is a very high standard. Everything now is going through pharmacies, pure medical.
Now, out of those pharmacies, how many pharmacies are there?
As of now, not so much because it's a transition period.
Yeah, we've experienced. We are experiencing that in Canada. We've just celebrated our 1-year canniversary.
Yeah.
Now,
congratulations.
Thanks.
Just now, no? Today?
Actually, it's today.
Yeah.
Hey, happy anniversary. And it's also the start of edibles and other products. Tell us a little bit more about the European market. Now, I know you're in Israel, but are you elsewhere? Are you looking at elsewhere?
Yeah, we are very focused on Europe. Our home market is super important for us. It's the base. This is where we're bringing the know-how and the expertise to Europe. What we have done, we decided not to be dependent on the export from Israel, and we developed a parallel organization in Europe. And Israel, for us, it's more the place for R&D, development of new products, innovation, and to bring it to the Europe, which is the commercial market that we are looking for. We are not going to Canada or to US. We are very focused. We are the only company that is completely pure EU player, and I think that it's something that bring us an advantage because we are focused in a highly regulated market. And we started in Germany, which is the most populated country in Europe, 82 million people. They have a medical cannabis plan. Everything is going through pharmacies, very high standards, very similar to what we are used to do. And we have done acquisition of a distribution company in Germany. And through that company, we're working in all of Germany.
Tell the listeners and the viewers a little bit about Brexit. Now, the news that we got is essentially, we get bombarded, hey, they're in, they're out, they're in, they're out, they're voting against it. What does Brexit mean for IMC, if anything?
So we don't feel it as an issue regarding cannabis because the UK have their own process of medical cannabis. They've been a bit slow about that. Like most of Europe, by the way. Europe is more conservative, so they take it more slowly than others. But I don't feel that it's something that should affect us.
You mentioned this earlier about your technology and your IP. What else differentiates you from other companies, from your competition? What makes you better than everybody else?
Okay, so I think that we are one of the first companies in the world to grow pharma-grade medical cannabis. We gained a lot of experience, a lot of know-how, and I think that what we see in other places with other companies is some of childhood sickness of companies, young companies that raised a lot of money and now facing all the complexity of the cannabis market. We have been through that long time ago. We've done many mistakes, okay, obviously.
But you need to. You need to make mistakes.
Yeah, you have to. If you're doing mistakes.
Yes.
Okay? But we learned out of our mistakes. We implemented that. And this is exactly what we're bringing now to Europe. Now, being the only company that focus only in Europe, give us a lot of advantages because Europe is going to be the biggest medical market in the world, cannabis medical market. Now, today, if an investor wants to invest in Europe because they believe in that market, it doesn't have any option today beside investing in IMC because there are only few other companies that work there, Canadian companies, and the EU operation is only a fraction of what they are doing.
Right. No, that's a really good point. What's your biggest mistake?
I've done many.
or maybe not the biggest, but what are some, maybe one or two mistakes that you've learned along the way that you've that have helped you grow?
So what I learned in that business is that it's very difficult to foresee the future, and it's very difficult to understand the timelines regarding the regulations. This industry is highly regulated, especially in places where we are going, because it's more pharma, and many times we're dependent on the regulator. So, for example, what we've done in Israel we decided not to be dependent and not to wait for the export. And we build our operation in Europe in parallel so that for us it doesn't matter when the export will be from Israel. We will be able to start and work regardless. But it took us time to understand that. Okay, I wish that we have started long before. Still, we are ahead of the market.
And on that note, I'm here with Mr. Shuster taking charge of his own destiny, and we'll be right back.
Broadcasting from the heart of Toronto's financial district at the top of First Canadian Place, CSE TV is your trusted source for what's happening in capital markets. Our #Finance podcast series gets you exclusive long-form interview content with visionary entrepreneurs and CEOs of companies in the news. The CSE's On the Street segments get you up close and personal with many of our listed companies. And don't forget that you can find the video version of this and all our media on our CSE TV channel on YouTube. For instant notifications, subscribe to CSE TV now.
And we're back with IMC and the CEO, Oren Shuster. Let's talk a little bit more about the standards and the high level of standards that has been set and that your company is meeting and I'm sure you believe exceeding. Tell us a little bit more about that.
Okay. So I think that it's a very good question because there is a lot of misunderstanding about that. In Europe and in Israel, it's completely different than what people used to see in North America. It's pure pharma play. The authorities treat medical cannabis like any other medicine. So you have to go to pharmacy, you have to go to the doctor, get prescription, very rigid, the policy about that. And then everything is going only through pharmacies. But it's way, way more than that because all the process of getting the certification to supply medical cannabis, it's a very complicated process and long process. You have to meet the standard which called EU GMP, which is good manufacturing practice. It's pharmaceutical standard, clean rooms, highly regulated. So to go through this process, first of all, it's very costly. And secondly, it's a long, long process. So I think that many companies don't understand the complexity of getting that. That's one of the reasons that today in Europe, there isn't almost any competition because it's very difficult for most of the companies to meet those qualifications. And because we are coming from a place, from Israel, which is very similar in the standards and the regulation,
Right.
it was much easier for us to do that only because we understood very well the complexity. And I think that today, what is happening in the markets where it's much more difficult to raise money, less companies will go to Europe and start their own operation with the EU GMP. And I think that that gives us leverage in the market because we are very focused. We are in the market. We have done our raise. We raised our money. We are fully financed. We don't need any money for the foreseeing period. And next year, we're going to make real profits. So I think that it gives us a huge leverage in the market.
Okay. Can you speak a little bit about the politics in Israel? Who's running the show? Who's in charge?
Unfortunately, I don't know. Okay. I really don't understand what is happening. It's so complicated now. I don't think that anyone understands what is happening.
Okay, you know what? We'll save the politics for the politicians.
Okay.
Let's go back to Europe and European outlook.
Yeah.
Let's what do you see? What's in store for IMC?
So all the projections saying that Europe is going to be the biggest medical market in the world. Europe is moving a bit slowly. Germany is much faster than others. And I think that all of Europe is looking at Germany, what will happen in Germany. Today in Germany, there are about 50,000 patients, and they're growing. So it's going to be a huge market. It's going to be very medical market. In Europe, they're looking for products after clinical trials, proven products, which are not in the market yet, okay, but will start to go, I believe, in 2021. And it's going to be definitely a huge market, but it's going to take some time. So now it's the time to take the position in the market. What
separates Germany? Why Germany? They have They have as many medical patients as Israel, and there's people now that can claim medical cannabis from the government, and of course this is all big. And we always hear, when I say we, in the North American market, we always hear Germany. What is it about the Germans?
Yeah. So I think that you hear about Germany because, first of all, it's the most populated country in Europe, 82 million people. A bit social in their approach regarding healthcare, a lot of support. And they decided to promote the medical cannabis plan and being the most advanced today in Europe. So I think that everybody is looking at Germany because of that and because they are the strongest country in Europe. And this is the importance of Germany. Because everybody is looking in Germany, a company that will be strong in Germany will have the better position to be strong in other places in Europe. And this is exactly what we are looking for.
And on that very, very positive note, I'd like to thank Mr. Shuster, CEO of IMC, and thank you, audience, for listening and watching another fine edition of #Finance.
Hi, it's Grace from the CSC reminding you to make sure to follow us on social media for the latest updates on our listed companies as well as new listing alerts. For more in-depth content, be sure to pick up our free quarterly magazine, Public Entrepreneur, available online at thecsc.com.